Hello, I'm Dr. Michael Hill. I'm board certified in general surgery and thoracic surgery and specialized in bariatric surgery. Following, you will view a video, which is a recording of our live bariatric information session. That session is intended to provide information for patients to decide whether or not bariatric surgery is right for them. I'm going to ask some questions prior to the video. If you write these questions down and answer them, this will serve as proof of your being present during the bariatric session. This is important as some information is required by insurance companies that you were present during this time. It also is the gateway to our bariatric center, at which point in time you can call and have an appointment to see me to discuss bariatric surgery options for you. Today's information session is just that, informational, and what it's designed to do is to help talk about what obesity is and the problems that are associated with obesity and how we measure obesity and what kind of things we can do to help treat obesity, mostly surgically, but there's also medical treatments as well. Most people are here because they've tried for a number of years and/or a number of diets and/or other treatment attempts at weight loss or for significant weight loss and have not been successful. And that's pretty much the usual. 98 to 99% of people will fail significant weight loss long term with non-surgical approaches. This handout that we've given you, we're going to kind of go through that a little bit because it's in front of you and that helps us kind of do these. We used to do a slide presentation, but everyone would fall asleep, and I understand why. So we're going to just do a kind of a town hall meeting-ish type of approach. So it's kind of more interactive. It basically talks about, there's some terms on page 3 of what terms we use: morbid obesity, obesity, overweight, ideal body weight, bariatric. Comorbidities means other health problems associated with obesity or to be ill with, comorbid. And what is obesity? Obesity is a disease, and the government has recognized obesity as a disease, and it's a disease of excess fat storage. And the problem with excess fat storage is when it becomes very significant or morbidly obese, other problems start cropping up, like high blood pressure, or what's called hypertension, or diabetes, which is when people's sugars go kind of real high, and or sleep apnea, which is when people stop breathing at night when they're trying to sleep. These are like the 3 major ones, but there's other ones also that are associated with obesity, such as what's called stress incontinence, and when you pee when you don't want to, those types of things, reflux disease or regurgitation with heartburn and things like that, as well as increased incidence of trauma. People that are morbidly obese get in car accidents easier and don't get better quickly from those things. Cancer rates are also markedly elevated in the obese population, as well as death rates per cancer stage. So if a woman has a stage 2 breast cancer and she's of normal weight, and there's a woman with stage 2 breast cancer who's morbidly obese, the morbidly obese patient has a higher mortality rate for that stage of cancer. They talk about BMI, and body mass index, or BMI, is basically relating weight and height together. And the way I try to explain this is that if I was 300 pounds and Shaquille O'Neal is 300 pounds, well, we're both 300 pounds, so what's the problem?
It's not taller.
My dad used to have a t-shirt saying I'm short for my weight, and now we understand what BMI then measures. So somebody with a really high BMI has more obesity-ness. So we can have a lady who's 4 foot tall and 400 pounds, probably has a BMI around 100 or something, or 80 or 90. You know, so understand what I'm saying? So the weight itself, the number, doesn't really help us understand that patient's or person's affliction with obesity, but the body mass index does. And on page 5 and 6 gives us these are kind of basic tables that you'll see on websites and things where you can plug in your height and weight and it'll tell you your body mass index. So on the left-hand side is height in inches, and 5 feet tall, I believe, is 60 inches. So if someone was 5'5" and 264 pounds, all these numbers are weights. If you look up, then the body mass index would be 44. And that kind of helps us gauge what body mass index is for different patients. The reason that body mass index is important is because it allows us to compare obesity-ness between patients. And that's important because as someone's body mass index is higher, their risk of all things is higher. Surgery, not having surgery, okay, all these things. So when we have people of different obesity-ness, we need to be able to compare them from a scientific standpoint to be able to assess risk and be able to counsel them as to what's safest, etc. Why is obesity a problem? Page 7. I talked a little bit about diabetes and high blood pressure. And obesity has become such a problem not because of just the obesity component, but of all the other illnesses that happen with obesity, that it has become the #1 preventable cause of death. That being said, smoking basically was the #1 preventable cause of death up until about a couple years ago. And obesity has been creeping up because its incidence and prevalence in the United States specifically, but in the Western world, has been increasing so rapidly fast that we're starting to see its health consequences in the population. So obesity with the diabetes and heart, high blood pressure, these things combine to what's called metabolic syndrome. And if you have long-standing diabetes, high blood pressure, and things like that, you're going to have heart disease at a much higher incidence. And it's the heart disease that's going to kill someone, or the cancer that's going to kill someone, or the heart arrhythmia that's going to kill someone, sleep apnea, which is not breathing at night. People don't know that they have sleep apnea, but they just feel tired all the time, and they just feel logy because they're not getting that deep sleep because their brain keeps going, whoa, you got to wake up because you're not breathing. What that really causes long-term is high blood pressure in the lungs, which is called pulmonary hypertension, which can cause dilation of the heart, which can cause arrhythmias, which causes death in that way too. So all the comorbidities or illnesses associated with obesity can get better and go away when the obesity goes away. And that's why our focus is to treat the obesity, so that we can bring people's body mass indices down into the more normal range and hopefully get rid of their diabetes or their blood pressure problems or their sleep apnea, and to get rid of the risk of cancer that's increased if they don't lose the weight, okay? The morbidly obese patient lives 15 years less than the non-morbidly obese population. And throughout history, our life expectancy since we were cavemen has increased up to about, I think it's 78 years old or something now. But if the incidence of morbid obesity becomes so prevalent that a significant proportion of our population has morbid obesity and dies 15 years earlier, then the aggregate life expectancy will drop. And obesity is striking children more than adults as far as a population base. And morbidly obese children become morbidly obese adults. And so if our morbid obesity rate in children is 3 times higher than adults, we're looking at a very bad problem in the future for our children, essentially. So it may be the next generation has a shorter life expectancy than our current one, which has never been seen in history before. So what causes obesity? Why is this happening? There's a bunch of different causes. 1 genetic and 2 cultural, 3 psychological. This is all on page 8 here. And a story I tell to try and describe the genetic component. We all may know of family members or so where mom may be big and dad's skinny, or vice versa, and they have kids and one kid's big and the other one's skinny. They eat the same thing. And it's just the way it is, and it doesn't seem fair, and it isn't fair. There's no fairness about this, but the truth is that the obese kid absorbs and retains the calories that he eats more effectively than the one that isn't. So think of it as a furnace. Okay, if the furnace runs efficiently and burns off all the fuel, great. If it doesn't, it stores it. Okay, so when we were cavemen, literally it takes millions of years to evolve into us. All right, where we had to chase our food around and or plant it, we expended a lot of calories just to obtain calories. And if you look at food sources, the sources of food that have the most calories per gram are sugars and fats. And they taste great because our bodies evolved to wanting those because you're extracting more calories. And in a situation where you don't know when your next meal is going to come, you want the sugar and the fat more than the protein. And that is why we like sugars and fats. Not because they taste good, it's the other way around. Those beings that ate those lived, and those beings that ate those liked those things, and that's the kind of evolution of that. Now, what happened in the last 100 or so years is that we've no longer had to chase our food around or dig holes with our own hands. We've become smart enough to invent machines to do these things. And this has happened in all facets of our lives, in that when we go to work, we turn on a computer screen and we sit in a chair, and this chair might massage us, and all those types of things. But so we're not really expending energy to get our calories anymore, and the calories are sitting in the grocery store on the shelf. And the economics of it is that the sugars and the fats are the least expensive calories to buy. So it's perfect. We love the stuff. It's cheap, and therefore we're going to eat it. So the combination of decreased exercise and increased intake is a cultural issue also, not just because we've evolved that way and we've been smart enough to have machines do our work, but that this is just the situation that has occurred in the last literally 100 years. And we've got ourselves into a pickle. And the pickle is that at a certain size, it is almost impossible to get that weight off. If someone's 15, 20 pounds overweight, it's more possible that they're going to be able to lose that weight than if someone's 100 pounds overweight, okay? And so because obesity is such a problem with all the other illnesses and the problems that are associated with that and the early death, etc., there's more severe treatments to treat the severe problem. And that has evolved as surgical procedures. So the next few pages, I think, start to talk about surgery for obesity. And this has evolved over the last 50 and 60 years. And currently there are 4 major operations that are accepted, that are safe, and that have good weight loss and improvement and or resolution of the comorbidities or other illnesses. And I'm going to draw these on the board, and they'll be next to each other so you can see and compare them. On the left side of the board is going to be the restrictive procedures and the lowest risk procedure, but they have the highest failure rate, just like anything. If you're going to do a lesser procedure, it may not work as well as the more aggressive procedure, which may be a bit riskier, okay? And then we can talk about the reasons why we choose these things, etc.